Megan, should I begin?
Yeah, I think we can go ahead. So, hey, everyone, I see a few familiar faces. So it's so good to see you guys, at least virtually for now. We are going to be talking about the capacity project today, which is super exciting. So I'm going to turn everything over to Dr. Fan. We are recording this, so I'll be sure to send out a copy of this recording to all of you all. And we will save some time at the end for questions. So you guys can kind of pop those into the chat as the webinar is happening. So Dr. Fan, I'll turn it over to you.
Great. Thank you so much, Megan. And hi, everyone. My name is Dr. Quinn Fan, and I am the partnership liaison on this capacity project, which is the short form for Community Academic Partnership for Primary Care Nursing Transformation. It's a mouthful, but basically, this is a HRSA-funded project of $2.7 million for 4 years to train more nurses in primary care, and then also to train more nurses to practice to the full scope of license. So before I launch into this, I just want to apologize in advance for those of you who have already seen this. I'm going to repeat the key point because I recorded a very quick presentation that is very similar, and some of you have seen it, and this is a chance for you to ask more questions, but then I believe that others haven't seen it. So I'm just going to go ahead and talk about some of the key points. Also on the call with me is Miss Jessica Starr. She is the project coordinator for the capacity project, and she will be instrumental in communicating with you when it comes to applying for the project, and then other details relating to requirements for the project. So Ms. Starr, I don't know if you could wave or say something so that you appear on the screen.
Hi, everyone. I know it's been sent out to you, and I'm sure it will be sent out to you again, but I'm also going to include in the chat here the capacity email for if you have any questions or concerns that arise that don't get answered today, or you go home and you realize you thought of 2 questions that you didn't have originally, so that you can get those sent out and we can get those answered for you.
Great, thank you. So moving on, so a little bit of a background as to why this project is in place. So we have, many of you are maybe aware that we have a very fragmented healthcare system here in the United States. There's a lot of resources devoted on acute care, and as a matter of fact, up to 7 to 80% of the healthcare dollars is spent in, the last month of a patient's life, which is, usually acute care or long-term acute care, and not so much emphasis being placed on preventive care. And so, everyone is realizing the issues here. And so there's a lot of effort trying to turn that around, particularly in the last year when we have this pandemic. We recognize how the public health and primary care system need more support. So fortunately, we have, some of the dollars being devoted to primary care to meet the basic needs for patients' behavioral health and how to integrate behavioral health into the primary care. Health promotion, wellness emphasis, and care coordination for patients with a lot of comorbidities and illnesses being discharged from the hospital or long-term care setting to their home, to the primary care setting. And then we also recognize the importance of coaching for self-management of the symptoms and chronic health issues, and then more attention being paid to social determinants of health that is not attributable to someone's behavior, and then increase access to care. So thanks to all of the recognition for all of those needs, that we received some funding from HRSA, which is the main organization, the federal entity that doles out money for training programs for healthcare professionals and preparing a workforce to deal with the contemporary issues in healthcare, that we received the funding about 3 years ago. So we received $2.7 million about 3 years ago. And so this would be actually the last year of our grant. And the main objective of the grant that we got here is to increase the number of nurses working in community-based primary care setting, and particularly serving the medically underserved populations. So when I mentioned about, increasing the number of nurses, I also talk about nursing students and then training nurses in acute care setting so that they could transition into primary care nursing and working to the top of their license. Okay. And to do so, we need to put in place training programs, support, and extra training for our nursing students, because I'm not sure if you are aware that a lot of the nursing programs, ours included, has a lot of focus on acute care settings. So, usually when you think about nurses, you think about them working in the hospital setting. As a matter of fact, when I tell someone that I'm a nurse, the first question usually is, which hospital do you work at, right? And I think that for some of you, it might be the same mindset that, when you think about nursing, you are more concerned about, okay, which hospital am I going to do my rotation at, right? And so this is going to help change that mindset. And so, Jessica, I'm wondering if it would be possible for you to also answer some of the questions. Oh, thank you, Megan. You're already answering those questions as I talk, because I still don't know how to read the comment to make sure that I answer those while I'm sharing my screen. Maybe there's not a way yet for Zoom. Anyway, so 4 years ago, well, 3.5 years ago, when we wrote the grant, we included some clinical partners so that they could work with us in training our students and nurses to work in primary care setting. So for those of you who are from around here in Atlanta, you might have heard about Mercy Care of Atlanta. So I can talk a little bit more about this later. But Mercy Care of Atlanta is a community-based organization that cater mainly to the population who is homeless around town. And then the other organization that we've increasingly collaborated with in the last year because of the pandemic, and that is the Boat People SOS. And this organization mainly works with patients who are uninsured, low income, and from diverse background. Many of them are Vietnamese immigrants and refugees, but also Hispanic population, and Russian, and many other people from different ethnic and immigrant groups. And then we also send students to a small city or a small town south of Georgia that is called Moultrie. Every summer, except last summer because of pandemic, we have this Georgia Farm Workers Family Health Program that some of you might have heard about it. So we send students there for 1 to 2 weeks, and then they mainly work with the migrant farm workers and their children, who usually don't have access to care or healthcare. And then other partners are being added, to increase the depth and breadth of your clinical experience. So what is the recruitment process? So we use the money to design training modules for nurses, but also we provide support to our students. So each year we recruit 10 students. For the first 2 years, we recruited from the ABSN cohort. And this year we recruit from BSN's cohort. And then the next year, which is, the 2021 and 22 school year, we'll be recruiting mainly from the BSN cohort. Jessica, you have a question?
Yeah, I was gonna say, just a quick clarification point. The deadline for the application is actually going to be May 30th, not April
Right.
30th.
Okay, thank you.
So just that you are all aware of that.
Yeah. So the application process is that you would submit an essay between 300 and 500 words. And we gave you the kind of pointer on the application site so that you can see. You will also need a reference from someone who knows you either professionally or personally, but ideally professionally, that can speak about your interest in primary care. Remember that this is a grant to train more nurses for primary care. So we would like to hear about that. The application, like Jessica said, is due at the end of May. However, the sooner you can get it in, the sooner we can, screen applicants and provide you with an answer. Okay. And then this is the link, and you can go there and submit the application. Again, as soon as possible. This is the end of March. And even though we give you 2 months of deadline, but I wouldn't advise you to wait until the last minute. And we will go through a screening process, and then we hopefully would notify you as soon as possible, but it's July is the deadline. All right. So what do you get if you are accepted into the program? So first of all, money. So we will provide you with $4,000 of scholarship support for a year. That means that it's $2,000 per semester. Now, if you are engaged in a summer externship, which is either locally or in Moultrie, as I mentioned before, then we will provide you with a small amount of stipend in the amount that range between $1,000 to $1,500, enough to cover some of the transportation cost and some of the living expenses. And then if you have to register for the summer course, we will pay for the cost of that summer course, which can be hefty if you think about it. And then we are negotiating to see if you could count that summer externship as part of your elective, okay? And then in return, you will conduct at least 150 clinical hours in community-based primary care at one of our clinical partners' site. And then, we will also provide you with, primary care intensive clinical, either during the summer externship or during the fall semester when you take the primary care nursing elective course. So it is not a requirement for you to participate in the summer externship, but it is a requirement for HRSA purpose to do 150 clinical hours in community-based primary care, and I'll talk more about it. And then also you're required to take the primary care nursing elective course, which will count towards your overall 2 required elective courses for graduation. Okay. So this is how the courses are laid out. So in the fall of your first year of the study, you will do 25 hours of service learning. Now, all of these are part of your existing clinical hours. You don't do this on top and or extra to your existing clinical hours. So for example, right now, I think that you're expected to complete 735 hours of clinical in total for the program before you could graduate. All of this 150 hours in primary care nursing is part of that, not on top of that, okay? So like I said, in the fall, you are required to take 25 hours of service learning as part of your service learning course, the 309. And you will do this at one of our clinical sites. And then that's how you earn 25 hours of clinical. Oh. In the spring semester, you will, so population health, or should I say public health now, that course is a required course for your spring. And as part of that course, you are required to take 50 hours of clinical. And so, if you are part of the capacity group, you will do your 50 hours of clinical in one of our partners' site, and that counts, okay? In the summer, like I mentioned, you can take an immersion course, but it's not a must. And then in the fall semester, you will be registering for the primary care elective, and that counts as 25 hours. I put SIMS in here because last year it was due to COVID-19 that we had to do simulation, but we could change that into an actual clinical hours. And then in the spring semester, you are required to take 50 hours of clinical as part of ambulatory care. If you are a capacity student, you will do that in one of our clinical sites, and then that counts with the total of 150 hours, okay? So all in all, we will ensure that you complete the 150 clinical hours in the primary care nursing setting to qualify for this program. and real
Quinn,
growth.
I think there's Janae has her hand raised for a question, so it might be
Sure.
on.
Hi,
Janae,
yes,
go
I have
ahead
a
and
really quick question. Do you mind going back to the last slide?
This one?
So yes, so you said for the summer, we're not required to take the externship. Are the up to 80 hours clinical, what is that? If we're not
So-
required to take the externship, then where do those come in?
So for those who elect to take the summer externship, you will have an extra 80 hours of clinical up to, So 2 summers ago, when all of our capacity student participated, they earned 80 extra clinical hours, but it's not a required thing, either to graduate or as part of this program. So as a
Okay, so
result
that
of-
would, sorry.
yeah,
So I
that
was
is
just gonna
extra.
say, that's 150 plus the optional 80.
Exactly. Yeah.
Okay,
Because you
thank
already, satisfied the 50 hours of clinical in the spring, 50 hour in the spring of next year, that's 100 hours. And then for the 2 fall semester, you earn 25 hours each. So that is already enough. Okay,
thank you.
you're welcome. All right. So like I mentioned, you are committed to these. These are some of the commitments, in return for the scholarship, as well as extra support from the program. So you will earn at least 150 clinical hours in primary care. This is part of your existing clinical hours, not on top of. Okay, and then we will ask you to document your clinical hours as well as patient contact in a database, which is like 3 minutes per week, if that. All right. And then summer experience, you not a required, but you're encouraged, and we will provide financial support for you to participate if you wish. And then you are required to take the primary care nursing elective in the fall of your, the second year, not the first year. And then at least once per semester, you are required to take part in a survey to see how satisfied you are with the program, and then, variety of other things, regarding to primary care nursing. And then we will do a follow-up at 6 months, a year, and then 2-year post-graduation to see, the impact that the program has on your career as well as your graduation, post-graduation activities. Okay. So these are some of the commonly asked questions, and I will address this first, and hopefully it will answer many of your questions, but then, you feel free to chime in as well. So are the 100 in primary care clinical hours are on top of the, I think that it's not 870, it's now 730, I think, of your clinical hours required to graduate. No, this is part of, okay? So you don't have to worry about, being extra busy just to satisfy for this program. Now, am I required to commit to working in primary care upon graduation? No. Most of our graduates end up working in acute care because that is, I'm realistic. That is where the money is, and you're at Emory, so you encounter a lot of debts, and so you want to earn some money first to pay off that debt. So we don't require you to work in primary care upon graduation. However, I can tell you that a lot of our students turn to primary care after working in acute care for a little while. Okay. And it's not a must, but it's more of a natural interest, because those of you who are here today, I hope that you have an inkling of interest in working in primary care, and that's why you are here, right? So the next question that a lot of people ask is, am I required to have those 150 clinical hours at one of the predetermined primary care sites? Yes. So we facilitate for your primary care training. And so that's why we have, sites that we already work with, the clinical partners that are devoted to training students in primary care. And so you're required to participate in clinical activities in those hours. But I can tell you that I wish that, there's a former or existing student, capacity scholars who could be on here today to answer this question. But I have to say that for the past 3 cohorts, there's nothing but praise for those clinical sites, because you have, 1, less faculty to student ratio, and then 2, we prepare the preceptors at those sites So they are very keen on teaching you as well as supporting you, and then be, you know, like very focused on your learning rather than, you know, at some other sites where they feel like you're in their way. So with that said, I'm done with this presentation, and I'm gonna open up the floor for any other question. So since I'm gonna stop sharing so that I can see who's raising hand and who's talking. Janae, I think, had the
Yeah.
hand up, right?
Yes. So the cohort of 10 that gets chosen, they attend the clinicals together as a whole group.
Only in the 4 or 5 clinical rotation that I mentioned. Now, sometimes they end up together, like half of the group end up together in other rotations, such as OBGYN or maternity or pediatric or acute care. Those rotations we don't have any control over. You can end up wherever you choose. But for, you know, service learning, ambulatory care, population, public health, you end up together. Yes.
Okay.
Yeah.
Thank you.
Katie?
Hi, I had a question about primary care kind of generally because
Sure.
like you mentioned, like I'm pretty much only accustomed to and I only know about acute care.
Sure.
So and then I know that it's a little bit like long term and kind of preventative, but could you go more into detail about what exactly primary care is and like what examples of specialties are?
Sure. Great question. So primary care basically refers to, you know, sort of like the gatekeeper before patients become so ill that they end up in the hospital setting. So places where you see, you know, nurses, physicians, nurse practitioners, MA, nursing assistant working together to see you anywhere from sort of like episodic illness, such as, you know, like ear infection, sore throat, rash, all the way to chronic issues such as hypertension, high cholesterol, diabetes, and then something else in between. So it's sort of like, you know, like, or more preventative, such as annual checkup, you know, well child care, for example, that is part of primary care. And that is very different from acute care where, you know, either because you haven't been cared for by primary care, for lack of access to primary care, or because you have something that has gone beyond primary care, and such as, you know, diabetes complication that results in renal failure that land you in the hospital setting with, you know, a very high potassium as a result of renal failure, or a stroke. You know, you have diabetes and hypertension and you smoke, and that had not been taken care of, or because it has been taken care of but not to the extent that it could be, and you end up with a stroke, and that's how you end up in the hospital setting, and that's acute care or tertiary care. So there you go. That is a key difference. So we sometimes call primary care, we lump that into ambulatory care. You may hear that term. So ambulatory care actually is a bigger blanket, and primary care is a piece of that. So when you hear about ambulatory care, you know, that includes something like an infusion clinic for someone with a severe infection that needs, you know, an intravenous administration of an intravenous medication for long term. That is part of ambulatory care, but that is not primary care. It's a specialty care. Or someone who has cancer and that needs, you know, chemotherapy. They usually don't end up in the acute care setting. They would do that in one of the oncology clinic, and they're seen by an oncologist and a nurse, and sometimes receive treatment in outpatient setting. So that is ambulatory care, but not necessarily primary care. So primary care is sort of like a subset of ambulatory care that also engage in public health kind of aspect. So, you know, we focus on prevention, we focus on, you know, preventive care. So that is there. Okay.
Thank you.
No problem. I'm not seeing any other hand. I'm not sure because they're not on my screen or,
Just saw Danae's hand come up.
oh, okay.
Yeah, I just have a quick clarification question. The capacity program is for both years, right?
Yes, yes.
Okay.
So at the end, you will receive about $8,000 at least, plus summer, if you decide to participate in the summer externship.
Great. Thank you so much.
No problem. I think that, for a lot of students, the feedback has been that the most valuable thing is not really in the amount of scholarship that you receive, but more in a more target and individualized approach to teaching in the clinical setting for the rotations that you're on our grant. All of our student cohort have formed really tight bond, during the time that they're on the capacity program.
Jean, do you have a question, it looks like?
Yeah, I had a quick question, just about, it said that it required a letter of rec, you mentioned. I was wondering, I haven't looked at the application process in depth too much yet,
Sure.
but I was wondering if that was supposed to be submitted by us, so we ask for it and they send it to us, then we submit it through a portal, or if they have to send it to you guys themselves.
I'm gonna let Jessica answer that question.
Yeah, so I might need some clarification from Megan and if she's still on as well. I know we were trying to see if we could get it, adding a file option to be able to put it in yourself or to send an email. I know that definitely you can either send an email or your recommender can also send that email. Megan, I don't know if you.
Yeah, so I'm trying to see if there's a way for us to allow a PDF upload to the application. To be completely transparent with you guys, I haven't been able to figure it out yet. But I do have a couple of emails into our system operator to see if there's a way to do that. So in the interim, if you're one of the first round of applicants and there isn't an opportunity to do that, you can just use that capacity email that Jessica popped into the chat at the beginning of the presentation and have either yourself or your recommender email the recommendation letter to that email. One thing to note, do just make sure that if you are the one sending the recommendation letter, please make sure it's in a PDF format so that it can't be edited. But yeah, I'm trying to figure out a way to get it to allow you to just upload it to the application, but I'm having to work through some systems issues on that for now. But in the interim, just go ahead and email it, but hopefully soon you will see a spot there to upload it as a PDF.
Okay, thank you.
Yeah, we're trying to give you choices so that, because sometimes recommender may not feel comfortable sending the letter directly to you so that you could submit it. And so that's why they can send it to the capacity email that Jessica just posted. And then we also make it easier for those who already have a letter of reference to upload it, like Megan said. But we're working that out. Okay, good question. Any other questions? Oh, we have two participants. Okay, Jennifer, and then Sylvia after.
For the person, so for the recommender, do they have to be a professor at a university, or can they be like someone that we personally know?
So like I mentioned that, ideally it would be someone who knows you professionally. It doesn't have to be a professor from the university, because many times in undergrad study, professor may not know you as well as in the job setting. For example, if you have a job that has a supervisor that knows you really well. So yeah, I mean, just think about the things that we are asking for is for someone to recommend you to be part of this very selective group of people and focusing on primary care. So anyone who could vouch for you about that, then they need to be asked.
Okay, thank you.
Sylvia?
I was just wondering if you could go more into depth about the summer clinical immersion programs. I know it's in at Mercy or Moultrie, and I know the one in Moultrie is the Georgia Farm Workers Health Program. So I was just wondering if you could go more into depth about that,
Sure.
how it works and what we would do in that.
Okay, yeah. So I can tell you right now, we have 9 scholars this past year. And then 3 of them are interested in Moultrie program. And so we will actually have a faculty dedicated to these 3 students in Moultrie. They will spend 1 week in Moultrie, and that is going to be June. It changes from 1 year to the next, but most of the time it's in June, either first or second week of June. And they will set up a camp. Basically it's a tent in the middle of a field, and this is a interdisciplinary kind of approach. So we'll have nurse practitioner student, we have DNP student, we have physical therapy student from I believe the Georgia State, and there may be some pharmacy student, and so basically it's a multidisciplinary as well as multi-school endeavor. And they set up the camp at night around 6 o'clock, and they start seeing farm workers with variety of issues from undiagnosed, untreated hypertension, high cholesterol, to stress related, to heat related illness. There's a lot of patients with renal disease that they don't know about. And so we screen for those. And then there's a lot of anemia patients. We see anywhere from episodic illness, like I mentioned, like skin issues, to wound care in the foot, to chronic health issues, like I mentioned, like high blood pressure and kidney issues. And then, so you work, at night in a very kind of hot and humid conditions. You go home, take a shower, sleep, and the next morning, depending on where things are, you might end up seeing students in their, or children in their summer school, and going over their physical exams so that you can fill out the form for them and preparing them for fall semester. So as an undergrad student, you are expected to do vital signs. You might end up doing a lot of patient educations. We also have faculty there to help you gathering some history on the patient so that you are familiar with, subjective assessment of the patient. So subjective meaning that you ask questions about, patient's illness and history and family history, surgical history, and so on and so forth. And then objective is when you measure their height, weight, BMI, blood pressure, pulse, breathing, so on and so forth. Now, for those who who opt to stay in Atlanta, you will work with one of our clinical sites, and then follow a nurse preceptors who have been trained and oriented on how to precept our nursing students. So the previous years we had students working with psychiatric nurse if they're interested in psychiatry. We would have students who work with patients who are homeless on street medicine team, doing a lot of patient education. We had students who work with patients who only speak Spanish, because we have a site in Chambly that only caters to Spanish speaking, well, not only, but the majority, like 70-80% of the patient there speak only Spanish. So there's like a lot of different variety that you can choose from. And like I mentioned, I'm working with a lot more partners. And so we are opening up opportunity to work with Grady Primary Care. They have 8 different clinics throughout town that they could take our students. And then I'm also working with Atlanta Harm Reduction Coalition, focusing on HIV prevention and care and diagnosis. So yeah, there's a lot. And so, with Moultrie, I believe that we've cut down on the amount of time that you spend in each of those externship. So instead of 80 hours, I think we're gonna be spending only a week in the externship area. So if you're in Atlanta, most likely it's 40 hours. And if you're in Moultrie, it's between 40 and 50 hours of clinical. Okay. Did I answer your question?
Yes, thank you.
I had a quick question, sort of
Okay, I can't
piggybacking.
tell who, oh, Jeannie?
Oh, sorry.
Jean?
Yes.
Yeah.
Piggybacking off of Sylvia's question, and I'm sorry if you already mentioned this. Is it so over the summer? Is it that you work at one or the other in Atlanta or Moultrie, or is there a possibility to do both during the summer?
I know that's exactly what my current cohort is undergoing. They're like, why can't we do both? Because both seem so interesting, right? The reason is because we have we assign 2 faculty for summer, and they can only do, a certain, we want to keep the ratio small. So we don't want to have one faculty supervising all 10 students who want to do both. And so, and then the timing is also a little bit tricky. And so, yeah, there you go. So
Okay,
unfortunately, you can't do both.
thank you.
I know when I asked my current cohort, how many are interested in Moultrie, 6 hands raised. How many are interested in Atlanta? 7 hands raised. So, yeah, it's great to have choice, but then it becomes a challenge to choose. Anyone else who hasn't spoken up or asking a question? Paul, I'm going to call you out to see if you have any questions for me.
Oh no, I had a same question as Sylvia, but it got answered. So
Okay. Good. Bianca, any questions? So one thing that I didn't really stress the importance of, but as part of this, you're also participating in a student-run activity called the Grady Health Coaching Project. And Jessica, I'm not sure if the site has been updated, but we had some information about it on our website, and then I just discovered that it was deleted for some reason when we updated our website. But Grady Health Coaching Program is a very interesting program that is focused on preventive as well as assisting clients with multiple chronic health conditions live a healthy life despite their many challenge in terms of socioeconomic challenges. So our students are part of that program from the beginning till the end of their time at Emory. So what do? You are assigned a mentor. You are assigned into a group of interdisciplinary health students. The program is run by a couple of 3rd and 4th year medical students, but also other students from the PA program as well as the MSN program here. And you are assigned a patient that was referred by Grady Primary Care. And usually those are patients who have a lot of different chronic health issues like lung issues or hypertension or diabetes, and who's not managing their illness as well because of challenges in terms of obtaining medication or healthy foods or smoking or alcohol, addiction. So you're assigned this one patient, hopefully for the whole duration of 2 years that you are with the program, and you get to work with them, you get to know them, you get to assist them in finding out more about health information as well as, healthy eating, exercise, and so on and so forth, becoming, like a coach and a partner in assisting them living a healthier life and overcoming their chronic health conditions. So that's what our capacity students have been doing, and it's bringing them a lot of satisfaction. Of course, it's time consuming because you need to work with the patient like twice a month sometimes. And depending on the patient and their needs, sometimes it's only 15 minutes check-in, and sometimes it's like an hour of your time. And we'll try to capture some of that time and credit you for clinical hours. But sometimes if you spend 6 hours on 1 week, then we can't really give you back all of that time. And so we ask you to gauge your commitment and time, and as long as you get to work with the clients and helping them. Okay. So Janae has a question about capacity, selecting only students with prior healthcare experience over others who may not have as much. No, actually we don't. We prioritize more based on your understanding and interest in primary care and underserved population. And then if you have any evidence of your prior work with that, then we would consider that. And your recommender as well. Okay. I hope I answered Janae's question. All right, I don't want to keep everyone on just for the sake of keeping you on, but no problem. I understand, Janae. Any other questions?
All right, everyone. Well, we have been recording this session, and we'll make sure that you guys all get a copy of the recording. As Jessica and Dr. Fan mentioned, please feel free to reach out to any of us via email. We're happy to answer any questions you have, especially once you start the application process. If questions come up at that time, we are all here to help in any way we can. And we thank you guys so much for joining us. Capacity is an incredible program, and our students who have done it in the past often mention it as kind of a highlight of their nursing career at Emory. So we're so excited that you guys are interested in the program and look forward to talking to you all more.
Megan, you just reminded me of something else that I
Okay.
forgot to mention. So we actually had a special ceremony to graduates of the capacity program, and we give you even a special court for just being in the capacity program. So that is one way for us to recognize the scholars who have been outstanding in the program. Yeah, so thank you, Megan.
Definitely. Well, thank you guys so much. And we look forward to seeing all of your applications come in soon.
And do it soon, please. Don't wait until the last minute. Thank you all. Have a wonderful weekend.
Thank you so much.